Hello, everyone. I'm Dr. Ashaye, and you're listening to Connecting the Dots with Dr. Ashaye. Okay, so one of the most common questions I get asked is, how can I treat this naturally? And oftentimes it's a person that has just been diagnosed with something, a condition, and they've been taking medications for a while, or maybe they're taking a lot of medications, or maybe they just don't want to start medicine. And they're wondering, okay, what can I do to treat this condition? The good news is in many conditions, including high blood pressure, there are several things that we can do to help, right? And I'm going to be talking specifically about natural ways to lower blood pressure. And at times, these practices need to be done in addition to taking medications, but sometimes that's all you need. You just need to do these natural things and the blood pressure will be treated. So again, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care. InTouch Primary Care is an innovative medical clinic, and we offer an alternative way to receive healthcare that is stress-free and focused on the patient. Okay, so high blood pressure, which we've talked about throughout this last few episodes, is when the force of blood pushing through the walls of the blood vessels is high, right? So it's a high blood pressure system. Blood is going through the blood vessels, but the pressure that it's going through the vessels with is too high, okay? So if you think about it, there are several ways that we can lower that pressure in the vessels. And the two major ways we can do this is we can relax the vessels, the walls of the vessels, so that the blood pressure can drop. And another way actually is that you can make the heart work more effectively to help reduce the pressure, or you can get rid of excess fluid. And that's what basically most medications do. They use one of these three ways of lowering the blood pressure. But we can also do this naturally. So how can we do this naturally? Well, the first way I want to discuss, and there are many different ways, but I'm going to talk about three today. The first way is we can exercise. So none of the things I'm going to talk about today are going to be things you haven't heard before, but I want you to listen because sometimes we hear things and we don't do them. And I'm going to give information about why things that can help you start to do these things consistently. So you may have heard these things before, but if you're not doing them consistently, then, I encourage you to keep listening. Okay, so exercise helps the heart get stronger so it can work more effectively. So there are certain types of exercises that are recommended, though, to help with blood pressure. And those are aerobic exercise, so things like walking, jogging, swimming, dancing, gardening, things that maybe make your heart beat a little bit faster. So these can lower your blood pressure significantly by strengthening the heart. Ideally, we want to do 90 to 150 minutes of these types of activities a week. So usually about 30 minutes, 3 times a week, 30 minutes a day, 3 times a week. And if you do this, a minimum of 30 minutes, 3 times a day, 3 times a week, studies have shown that you can lower your blood pressure as much as 5 to 8 points. So some medications, that's pretty much what they do. They lower your blood pressure 5 to 8 points. So if you exercise, and obviously the more consistent and the more exercise that you do, there's a limit as to how much you'll lower it, but you can get a much better blood pressure by regular exercise. So that's number one. Okay, number two, lowering your sodium content. Again, I'm sure most of you have heard this, that you can lower your blood pressure by lowering your sodium intake. And this is because sodium draws water, right? So if you have a lot of sodium, you're going to get a lot of extra water being pulled in. So people with high blood pressure can naturally lower their blood pressure by lowering their sodium intake. But how much? Well, ideally, you want to get 1,000 to 1,500 milligrams of sodium a day, which is about half to 3/4 teaspoon of salt. But how do you track this, right? Because sodium can be hidden in a lot of food, and many things that have sodium don't taste salty, so it can hide very easily. So the first thing, you always have to read food labels. There's no way to track your sodium if you're not reading food labels, especially if we're picking up processed foods, things in cans, things in packaging. You need to see how much sodium are in these things before you start eating them. And make sure you look at the serving size. So that's the first thing. Ideally, to reduce your risk of getting too much sodium, the best thing is just cook at home if you can. And when you cook at home, you can actually measure out how much salt you want to put in your food ahead of time. So just have a little container, put your half teaspoon or quarter teaspoon, because you're going to get sodium in other places too that day, right? So just put, to be on the safe side, put a quarter or a half teaspoon, and that's all you're allowed to use that day. But if you're cooking in bulk, you have to make some calculations, but you can measure it out, right? And then just watch out for additional sodium from other sources. Ideally, you want to just avoid, sodium completely, especially salt. Definitely not adding it to your food. Ideally, you want to cook with other seasonings. And these days, there's so many other options, cooking with other seasonings that do not have salt. But if you are absolutely going to add salt, you can also measure it so that you can make sure that you're not getting too much and make sure that you're looking at the labels. So doing this consistently, getting 1,500 or less sodium in your diet has been proven to lower your blood pressure by 5 to 8 points. So you can get, if you did exercise and then you're lowering your sodium intake, you can get down 10 points. So if you were at 140/90, for instance, you can be at 130/90 or 130/85, something like that. So it is worth looking into to lower your blood pressure. Okay. The last thing I'm going to discuss is avoiding or limiting substances that raise blood pressure. So these are stimulants, things like that, like caffeine. And caffeine also is like sodium, it can hide, So, coffee, hot chocolate, energy drinks, especially. So just being aware of things that are stimulants that can increase your blood pressure, and even alcohol can increase your blood pressure. So by limiting alcohol intake, that can also help lower your blood pressure. And that has been shown to lower your blood pressure by about 4 points or more. So limiting alcohol to less than 1 drink per day for women, less than 2 drinks per day for men. But honestly, I'd say, you want to, based on where you're starting, you want to just limit that or lower it and go from there. And I'm going to talk more about how to track these things and limit all these things. Okay, so I know most of you have heard at least about doing at least one of these before. But like I said, most people don't do these things consistently. And I know because I talk to people all the time about their blood pressure, and they can tell me all the things they're supposed to do, and oftentimes they're not doing it. And I think part of that is because many are not fully convinced that it works. And so I'm going to share what I recommend to my patients that have helped a lot of them to start doing these things consistently. But before I share, I want to ask that you help us spread the word, share these valuable resources with others. And there are 3 easy ways you can do this. You can subscribe, you can share, you can like this video. And by doing these 3 things, subscribing, sharing, or liking, you help others improve their health. You help us reach a wider audience. And you're just telling other people, check out this video, learn more about your blood pressure. So this is a small action that can make a big difference. So if you haven't already, please go ahead and subscribe, share, or like. Okay, so what do I tell my patients? Well, what I tell them is do a trial. Do a 1-month trial. Do regular exercise or limit how much sodium or avoid substances that raise your blood pressure. You can do all 3 at once, or you could do one at a time, but see what the effect is on your own personal blood pressure, because everybody's a little bit different, right? So before you start your 1-month trial, check your blood pressure, get at least 14 values. You can check daily for 14 days, or you can check morning and night for 7 days, but just get a baseline, right? And then go ahead and, avoid the stimulants, avoid your coffee, go ahead and reduce the sodium in your diet, exercise, and then see what happens to your blood pressure, right? Give it a month, check again, check another 14 values, and compare your baseline to the 14 to the next, time you check, and see what happens. And, get convinced on your own. whether or not it works for you. Okay, so there are other things, like achieving a healthy weight, healthy sleep, stress reduction that can help lower blood pressure. And you can do the same with, with those things that I just mentioned and track your blood pressure and see if it works, if it lowers your blood pressure when you do these things. Okay. And then another thing I tell my patients is act as if these practices are medications, right? So especially for those that don't like taking medications, if you don't like taking medications, then you kind of think about it. When I'm exercising, I'm taking a medication, and even if you don't feel like it, you do it anyway because you rather exercise than take a medication. You rather limit your salt than take a medication. So think about it as, okay, this is my medicine. This is what I'm substituting for medicine right now, and do it consistently, because when you skip your medication, blood pressure goes high. Same thing. When you skip the exercise, your blood pressure goes high. So it's something that needs to be done consistently. Okay. So the other thing is, best case scenario, these things work for you. You lower your blood pressure, you reduce or maybe stop medications altogether. That's best case scenario, right? Worst case scenario, it doesn't work for you. Your blood pressure doesn't go as down significantly. Well, the good news is you still gain because you feel better with these practices. These are healthy practices that help all your organs anyway. So it's not you lose nothing by trying these things and doing them consistently and tracking. So what if these don't work for you? Or, what if you just need some accountability? Well, I recommend that you work with your doctor because there might be other things affecting your own blood pressure that need to be addressed. Things like sleep apnea, things like other sleep disorders or anxiety. So there are many things, that may need to be addressed for your blood pressure to be reduced with these natural things. So you want to also, check with your doctor. And if you are in the Houston area and you have high blood pressure, any other condition, and you're looking for a doctor that is proactive about your health, well, we're here for you at InTouch Primary Care. You can learn more about us on our website, or you can call us 713-280-9985. And we look forward to helping you on your journey to a better health. Okay, so imagine you start exercising, or you're lowering your sodium intake, or you're limiting substances that raise your blood pressure, and your blood pressure drops, and you've limited the number of medications you're taking, or now you're not taking any. You feel better regardless. So these behaviors improve your overall health, and then you're preserving your organs, you're reducing your risk for heart, brain, kidney, eye, and so many other conditions down the road. And you can look forward to a good quality of life to enjoy with your loved ones. So I hope you try one of these things today if you have high blood pressure, and, work towards a healthier you. I hope that helps.